Hi, I'm Dr. Sherwana Davis, and I'm a psychotherapist. And one of the questions that I often get is what is the difference between a psychiatrist, psychologist, and a therapist? That's a great question. And I will give you the short version of the answer, and then I'll also provide you with a little bit more detail. So, short version is psychiatrists are medical providers. And so their interventions that they typically use have some sort of medical aspect to it, whether it is prescribing medication or some other medical technique or tool that they're using in order to treat whatever your mental health condition is. A psychologist is someone that can provide therapy, but they specialize also in providing testing. So, this is the person that you go to for intelligence testing, aptitude testing, personality testing. And so they take that information and then they diagnose and then they go forward. If they are someone who actually provides you with therapy, they can then go forward and actually provide you with therapy or refer you to a different type of provider. But at their heart, they are great at testing and they also provide therapy if that is something that they choose to do. Sometimes they just do the testing and then they refer out to clinicians to provide therapy, or if needed, they can also provide a referral to a medical provider or a combination of both. And then you have your therapist. The therapists are people who actually they can do some assessments. They don't necessarily do assessments that are psychological testing the way that a psychologist does, but they can provide some assessments of some symptoms to give them some insight into what some of your symptoms are and the level of severity associated with those symptoms. And then they typically will provide a treatment plan and then they go forward with treating that. If it's something that they cannot treat, then they will refer out. So if it's a medical condition, they will refer you to a medical provider, or if they think you need some additional testing, they will actually refer you to a psychologist to do a full psychological evaluation. And so that is from a big picture perspective, that's the three types of categories when it comes to mental health providers. Now, here are more of the details. So, there are psychologists. The psychologists are typically people who are licensed at the doctoral level. So, they either have a PhD or a PsyD. And again, they can provide with therapy and also that psychological testing. Then there are your counselors, clinicians, and your therapists. So these are people who are typically licensed at the master's level. They also can have PhDs as well, but in terms of licensure, the licensure is based on their master's degree. And so these are people like licensed professional counselors, licensed marriage and family therapists, and in some states, they can also be licensed clinical alcohol and drug abuse counselors as well. You also have in that same bucket of people that can provide you with therapy are clinical social workers. And so these people can provide you with that therapeutic component, but they also have additional training in case management. And so they can also provide some of those services as well if that is one of their service offerings. And typically, they are licensed, and their licensure is either a licensed independent social worker or their license is licensed clinical social worker. And there are a couple of other variations to that in other states as well. But most of the states either license people as this licensed independent clinical social worker or licensed clinical social worker. And then, of course, you have the prescribers. And these are your psychiatrist or your psychiatric or mental health nurse practitioners. The psychiatrists are people who have degrees in medicine. So they are either a doctor of medicine, an MD, or a doctor of osteopathic medicine, so a DO. And then, of course, you have your psychiatric or mental health practitioners as well. And so they are typically people who have some sort of degree in that nursing area. Also, you may be able to get some services from your primary care physicians or your family nurse practitioners. The key difference there is they are typically generalists, so they don't necessarily have that specialized knowledge that a psychiatrist or the nurse practitioners may have. So those are some things to keep in mind as well. But they are great, particularly if there's just some general things that you may be experiencing that you need some support from your medical provider. I will provide you with the link to that site that I was just at, that NAMI site, that actually goes through the details that I just described about the differences in terms of mental health professionals. And I hope this helps as you begin your search for mental wellness. Thanks so much, and I wish you peace of mind.